Hello everyone. Today we are going to discuss the skull on the basis of its superior view, which is also known as norma verticalis. So, when we view the skull from above, it is usually oval in shape, nearly circular or usually oval in shape. Okay, and the shape may be wider posteriorly and narrower anteriorly. Now, this is your frontal bone. These two are your parietal bones, and this is your upper part of occipital bone. Now, this frontal bone is divided, is separated from two parietal bones with the help of this suture, which is known as coronal suture. And these two parietal bones are separated with the help of sagittal sutures. Now, between the occipital bone and two parietal bones, there is a lambdoid suture, and the center point between these sutures, that is coronal suture and the sagittal suture, is known as bregma. And the center point between the lambdoid suture and the sagittal suture is known as lambda. Now, one more thing is here to remember is the anterior fontanelle and posterior fontanelle. Now, what is anterior fontanelle and what is posterior fontanelle? These two are membranous gaps which are usually seen in infants. This anterior fontanelle, it is seen at the age of 18 to 24 months, and this posterior fontanelle, it is seen at the age of 2 to 3 months of age. So this anterior fontanelle, which is a membranous gap, it gets ossified or gets filled with bones at the age of 18 to 24 months. In children below 2 years of age, if there is a depression at this area, you can assess degree of dehydration, and if there is bulging, then it suggests that there is increased intracranial pressure over this area. Now you can also see one more thing, that is parietal foramen. These two are your parietal foramens on each side. These two are your parietal foramens on each side, and they pierce the parietal bone near its upper border, 2.5 to 4 centimeter above the lambda. Yeah, in front of the lambdoid suture. These two parietal foramen, they transmits emissary vein. from veins of scalp to superior sagittal sinus, from veins of scalp to superior sagittal sinus. Now between these two parietal foramen there is a point, yeah, there is a point on the sagittal suture which is known as oblion. Now one more thing is here to learn. There are temporal lines are also situated over here, over this area. Over this area there are temporal lines are also situated. So what I have told you that about anterior fontanelle is that if there is bulging, in case of bulging, it means intracranial pressure. Okay, and if there is depression, then it means mostly it is due to decreased intracranial pressure and mostly due to dehydration. Mostly due to dehydration.